ready? Sound check. You guys know how to spell my name? Streckenbach. Brown County Executive. I had to tell a reporter this weekend. Okay, my name is Troy Streckenbach, Brown County Executive. I'm here with our Public Health Officer, Anna Nick, and our Brown County Board Chairman, Pat Buckley. We're here today to talk about our efforts around the fentanyl and opiate crisis within our community, and if not in our state and in our whole country. As you're aware, 2 years ago this month, I declared fentanyl as a public health crisis and called upon our public health department to take the lead in terms of building an awareness, building a community team to really figure out how can we as a community tackle this issue. We recognize as government that this issue cannot be solved in one organization, one individual, and it would require the community as a whole. Brown County, because of the settlement dollars due to the opiate crisis in our country, did receive dollars that we've allocated, and with the county board put together a plan and how we're going to allocate those dollars. In addition to those dollars, we've allocated dollars that we received from the ARPA funding, which was some of the initial dollars that the Public Health Office used to really begin that campaign that we made to the public. And really that's where we started, was we needed to sound the alarms to the public. And that's what happened when I did the public health crisis, doing the proclamation and making this an issue that we as a community needed to address. As you can see from the chart to the right of me, it shows you why this was becoming a concern from our country, or from our county's perspective. And what you're going to hear from Anna today is where we're at. We don't know what is truly getting us to these numbers, but I can tell you that as a community we should be really proud and happy to see the numbers where they're at. This is a shocking development that we should all be very proud of in Brown County, and that tells us that we as a community, all of us taking part in this effort, should be really commended in terms of, at minimum, putting a stop to the overdoses taking place, or at least minimizing the amount that are happening. Now the reality is that there's still a major crisis within our country and within Brown County that continues to be a need for us to address. And so through our partnerships with public health, through human services, through our county board, through our sheriff's office, collectively as one part of it, government, we're doing what we believe is in the best interests of the community. And of course we need families, we need parents, we need nonprofits, we need schools, we need faith-based, we need everybody really truly doing their part to help us with this issue. Last year, in previous budgets approved by the county through the health department, we put on a number of different campaigns. And Anna's going to talk about some of those, whether it's going to the school districts, mailers to the homes, doing live TV, or not live TV, but doing broadcast commercials during NFL football games, partnering with the Green Bay Packers, Wisconsin Counties Association, the area health departments, doing trainings with municipal clerks on how to administer Narcan. I think a lot of this has helped us in part to show the numbers that are here today as far as our overall effort. With that, I'm going to ask Chairman Buckley just to say a few words from the county's perspective, the county board's perspective, which ultimately decided and allocated on a 10-year plan the dollars that would go to Health and Human Services for their purposes, and then the dollars that would go to public safety, specifically with the Drug Task Force and helping us really kind of hone in on where these drugs are coming into our community and how can we stop that flow. So with that, Chairman Buckley.
Yes, I feel like this is just a great example of how the county board worked with the county executive, his staff, the various department heads, for us to come together and put together a multi-approach plan on how to spend the opioid dollars. I feel it was well thought out, and it involved a number of different people who all came together to put this plan together. Now, should it be looked at and revised? Yes. Right now it's a 10-year plan. A lot of things can change. These numbers are low right now, but I don't know if we can really explain why they're so low at this point, but we'll take that. We'll take
Right.
it.
Right.
Yep. So it still remains a problem that still needs to be addressed and still needs to be very vigilant on both the programming side and the enforcement side.
Yeah, and so obviously we're really pleased with the numbers that we're seeing in terms of the overall community, but the reality is that the work really needs to continue from what the county, when we think about that prevention, recovery, rehabilitation. And so with that, I'm going to ask Anna Nick, who is our public health officer, to really go into some of that high arching efforts that the county's public health office did in the initial terms. Some of the committees that were created to have a stronger effort around our responses to this. So, Anna?
All right, thank you. All right, good morning. So I recall when we first did the declaration 2 years ago, and I had raised the point that I'd asked my children, 4 of them, had they heard of fentanyl in the past. And at the time, none of them could, which really highlighted part of what our critical issue was, is that we needed to increase awareness of fentanyl and the risks of overdoses, because at its fundamental stage, people didn't know what it was. So we've put and spent a considerable amount of time on creating awareness. We did the regional campaign, which was a partnership with WLUK and several other health agencies to really promote fentanyl. We partnered with the schools in the sense we created flyers and tools that people could take home and talk to their kids about, and sent those through the schools. We knew from listening sessions that we've done, as well as what are ways that we can improve overdoses in a community, that we needed to increase Narcan saturation in the community. So considerable work has been done, and I know Executive Struckenbach pointed out a couple examples of making sure we're training and getting Narcan out in the community. That way, if somebody does experience overdose, we can save them and then get them to the needed resources afterwards. So a lot of work has been done there. Just this year alone, there's been 8 different trainings, as well as 4 just general awareness trainings. But when we break those down, they're to key partners such as the Room Tax Commission, or the lodging, the Brown County Tavern League, for example. So we're trying to reach those partners who want and have exposure and want to have that education, so that if somebody is in one of their one of their hotels, or if they're in a place, that they quickly are able to have staff trained who can give Narcan. When we look at the draft coming, we know that there's the potential for more interest around having Narcan training. So we're working with partners, even things like Uber and Lyft, to how can we increase Narcan saturation in the community, because again, we know Narcan is very effective in reducing that overdose. Other things, so we had the awareness campaign where we have reached millions in terms of our marketing campaign we did through WLUK, but when we look forward, what we want to think about now is, what is that next step? So we understand that awareness is critical. But we also have to think about what is it that we want people to focus on. We still encourage you, if you haven't yet talked to your kiddos about fentanyl or overdose, that we want you to do that. But we also want you to think about stuff like what gets our kiddos to that point? How is school going? Is it stressful? What's happening in their friend groups? Are there competition or games to take pills and they don't know what they are? Are people feeling stressed about what's happening at work? So helping us to understand that then helps us to understand that we in general need to get more coping strategies and coping skills out to our youth, to our children, so when they get stressed over that exam or they get stressed because they have the big game coming up, they are looking at ways to cope with it so they're not even reaching for the pill in the first place. So a big part of our campaign this year has been a partnership with Bellin Health and Kenny Clark to create a video. It's going to be a youth-focused video that's almost ready to launch, and that will be sent and shared with the schools. That will be sent and shared. We'll put it out on our social media. But it is just an attempt to bring our youth in, and especially from a sport focus, because we know that has such a key area of interest for our youth. But to hear somebody as a football player saying, this is my experience, hearing a behavioral health provider saying, here are some things you can do, we're hoping it's going to connect with our youth so that they can develop these coping strategies on their own, never getting to the place where we have to use these pills. So that is another piece that we're working on. And the last thing that I would mention is that the task force was something that was created out of the declaration. The action plan from that task force was successfully completed and has been handed over to the Coalition for Change, which is a coalition focused on substance use and prevention, where they are going to be putting that plan that was built based off of our efforts through the 3 task forces, based off the data we gathered, based off our listening sessions. They have identified the key things we're going to work on as a community, and they're going to work to make them happen. So we see that as a success as well, that we were able to pull the task force together, do what we need, create that plan, and now it's moved on to a coalition who's willing to take it and put it into action into the community. So those are some of the things based on what we've done in the past to where we are today that I wanted to share with you all.
Thank you, Anna.
Yes.
So this is not going to end over a day or night, a year. This is going to be a journey that our community is going to be on, and hopefully through all of our efforts as a community, we can continue to tackle this issue. And as you look at this number, this is as of September 10th, 2024. We have, unfortunately, still deaths that are taken due to overdoses. But right now, based on what our efforts around fentanyl, we have 11. It's 11 too many, of course. But as of September 10th, hopefully we don't get to 49, 50. We see, and as you can see, there was a continuous trend, and now we're starting to see the trend down. It tells us that family members are having conversations, individuals are finding resources to address some of those issues that may have created. We're getting more Narcan training in the hands. Law enforcement is doing more from getting the stuff off the streets. And so from that standpoint, I think right now this is a good sign. Let's hope that the next 3 months don't turn that upside down. But overall, we wanted to be able to give you kind of a here where we're at after 2 years since we've declared it a public health crisis. And hopefully this is a good sign that we're on the right track and that we're expending the dollars appropriately and we're allocating the resources in a manner that is effective. And so that, at this point, concludes the official discussion. We're all available for either one-on-ones or questions if you may have them.
You made me a data point, just to point out, when you look at the data, we are lower than we were in 2018, right? So we saw the true change, not in that, I suppose, halfway.
Yep.
We are seeing a change in the curve, which is what we want to see. So anytime there is a prevention type related effort or a community-wide effort, what you want to see is what you're seeing here. We see it kind of go up and then you're seeing it come down, which says that the community are putting in strategies that are effective. why we say it's so hard to identify what, because so many people is working on this right
Yeah.
now. There's so many things that are happening tangentially that go towards this, but it's the collective effort, which is why you're seeing this as a community.
And people, some people wonder if the county is doing enough, if there's been enough discussion or awareness, and we're clearly, from our standpoint, quietly working behind the scenes, engaging in empowering individuals within our community to, do our best to be able to make the change. So hopefully that continues to be the trend. And hopefully our 10-year plan, as it gets modified over the next, because we know that there's going to be something new that's going to come forward, but now we created kind of a strategy internally to help us mitigate these things as they are identified. All right.
Can't emphasize too much on the government, Brown County government, working together with the public.
Yeah.
That's been key.
Mm-hmm. Yep.
We're now available for questions if you have them, or one-on-ones.
I've got a couple questions for Anna. So, we see the downward trend, and you guys brought up a couple of things you guys have been doing that kind of help that trend. Is there one thing in particular that you can point to and say this made the biggest impact? Was it just getting the opioids off the street? Was it Narcan? Was it just bringing more awareness?
That is where I would say again, when we think about prevention and kind of wicked problems like this, it's very difficult to narrow that down because everything you just said is happening. The sheriff's department is doing an excellent job of isolating and getting it off the streets. Our partners in behavioral health areas and treatment areas are building up those systems and doing more in those areas. Public health and prevention, there's more education that's out there. There's more harm reduction out there, such as Narcan. So if you put them all together, it creates that bigger why we're moving. It would be really hard to say anyone by themselves is doing it. We need it all together.
The reality is that right away, off the beginning, when we allocated the dollars for the public awareness campaign, we got that in front of a lot of people. Not only did we get it in front of people through paper, through the school districts, every school district, every child went home with one of these papers talking about, you need to have a conversation with your child about fentanyl. Not only did they get it that way, we also mailed it to every household in Brown County. And in addition to that, we held public listening sessions, and then we did this region-wide collaborative effort with Wisconsin Counties Association, area public health departments, county public health departments, the Green Bay Packers. All of us collectively put in dollars to do a media buy when most people were watching. Just like this Sunday, people were watching the Packers, right? We knew we would have a regional audience, and that reached millions of people. And so we think we got the message all right away to hey, take notice, public awareness. But again, it ultimately came down to what are individuals doing once they hear the information, they receive the information. Are they willing to have that tough conversation with their family members about how to address it when they come into contact? All the other stuff is ancillary in terms of Narcan training, law enforcement, prevention. Really, from our standpoint, we wanted to get the word out. I don't know if that necessarily impacts that number. I think that's a community-wide effort that ultimately is impacted by the system, the community addressing it from multiple different avenues. But I know that from our public health declaration, saying this is a health crisis, we needed to immediately get the word out as best as we could, and that's how we did it. And we think we're pretty effective, at least at getting it in front of somebody. Whether they read it or not, we're not sure. But that's how we approached it.
Gotcha. And you guys mentioned in the press release that you have two more events after this to talk more about how you guys are allocating funds. I guess the question was just going to be, what can we expect to hear at those events?
So from our public health, from the Health and Human Services, you're going to hear from Eric Pritzel, our Director of Health and Human Services. He's going to talk more about how we specifically are looking at the recovery, rehabilitation side of things, the prevention. And then from the public safety, you're going to hear from the sheriff's office, more specifically, what are these drug task force fentanyl agents working on specifically. It's very narrow focused in terms of how we're using those dollars, these agents that we put onto the staff to really focus in on how do we get it off the streets. And so we knew when we went into this that it's not going to be just one solution that solves the problem. We know we had a supply problem coming from wherever, and we needed to tackle that, so we had to get rid of the supply that's coming in, and then we also had to work on the demand side. What's creating these situations that individuals feel that they want to take this? And in some cases, as part of the one pill can kill campaign, a lot of times kids were taking a pill not knowing that it was laced with fentanyl. So that was the other part, was just the shocking reality that if I experiment as a young teenager with this pill party that I think is Adderall or Percocet and ultimately take it, and then the next thing is I'm dead. That was the shocking reality that a lot of families were experiencing as we can see those numbers, right? So that's the second part, right? We're trying to figure out how do we help individuals. And then we know from the opiate crisis that we've had an overprescribed situation in our country where individuals who are trying to deal with an ailment were taking drugs, and that morphed into other things. And so we know that individuals within our community need help, and we're trying to figure out that fight. And that's where the county, once again, with limited dollars, we're trying to do our best in helping create some infrastructure internally to help individuals out. But again, this is going to be nonprofits, it's going to be the state, it's going to be the federal government, it's going to be local government, it's kind of everybody, all hands on deck. That's what you can expect. More of that detail that'll help you. Today really was more about overarching. 2 years ago, we declared this a community health crisis. Those were the numbers which forced us to actually do this. And today, 2 years later, we're starting to see some of the efforts that the county's doing, along with all of our community partners. We're seeing the trend bend the right way. And so this is a positive sign that some of the efforts that we're doing are working. We got a lot of work ahead of us, a lot more communication. And as we looked at this, we didn't want to just spend it in 1 year, the dollars that we had. We knew that this is a long journey, so we allocated it over a 10-year period. Make sense?
Yep.
Okay.
You guys have anything else?
Touched on all of it.
I think we're good.
All right, awesome. Thanks, guys.
Thank you.
Thank you.
We're gonna get more, obviously.
That's what we actually got now.
Yes.
Okay, so we allocated based on what we had.
Until I saw a
Okay.
commercial on TV. Hey.
All right, Buck. I gotta get back.